This is Carrie Howell from Cornell University Wellness Program, and I'm going to spend just a couple minutes talking to you about frostbite and hopefully the prevention of frostbite when you're outside enjoying the snow and the cold weather in upstate New York and doing things like snowshoeing, hiking, ice skating, all those things that you love to do as the mercury starts to drop and you add some layers and get on out there and play in the winter. So frostbite is the progressive freezing of your skin and the underlying tissues that are underneath that outer protective layer of skin. It occurs in 3 different stages, increasing in severity, and knowing the signs and symptoms of it and how to treat it can really help quite a bit in preventing some discomfort and potentially some things more severe like nerve damage that can occur if you ignore it. So frostbite, it can occur and you increase in risk in as little as 5 degrees Fahrenheit or lower. And if there's a wind chill that you're experiencing that's negative 16.6 degrees Fahrenheit, you can experience it in as little as 30 minutes. So it is something to take seriously, especially when you've got some exposed skin like your nose, your ears, your fingertips. Make sure that those areas are covered. And things that even do have some covering on them, like your feet, if your gear doesn't fit quite well and it's restricting some of the blood flow to those areas, they can experience frostbite as well. So let's talk about the signs and symptoms of frostbite so that you're aware of it and can take preventative and treatment measures as soon as you start to notice some signs and symptoms of that happening. So as far as signs and symptoms, the first stage is called frost nip, and what you'll notice is a redness and a coldness to the affected area. So as soon as you start to see that, add some layers or head inside and get warmed back up again. You won't experience any type of permanent damage if you experience frost nip. The second stage, and where you get to be even more severe, is called superficial frostbite. And in that stage, you start to go from the red, cold skin to potentially some numbness. Your skin may take on a harder or waxy type look to it, or a grayish blue tinge to it. That's when the topmost part of your skin and some underlying tissues start to freeze and you start to experience some more severe results from that. If you do experience that, you need to take action to rewarm the area immediately. Do not rub the area, but you do want to get inside to a warmer area, fill up a bathtub or something that can hold water, warm water in it, that's around 99 degrees to 108 degrees. Submerge the affected area for 15 to 30 minutes and gently rewarm that area. If you are experiencing or did experience the second stage of hypothermia, that superficial hypothermia, you may develop some small blisters that are fluid filled within 24 to 36 hours. You should, regardless of if you develop the blisters or not, seek medical attention or medical advice if you are in that second stage. You may experience also some pain as you rewarm that area. Taking something like ibuprofen is recommended. You may also experience a little swelling and tenderness in the area as well. The third stage of frostbite is the most severe and it's called deep frostbite. That's when multiple layers underneath your skin have frozen and are affected. At that point, it is critical to seek care as quickly as possible, preferably an emergency room or anyone who can provide that critical care to allow you to gently rewarm the area. As you rewarm it, your skin may take on a black or very dark gray look to it. You're going to experience quite a bit of pain, and you're going to have very large blisters. If you ever do get the blisters, do not pop the blisters. They are a protective mechanism that your body is eliciting. So seek medical attention for second or third stage of frostbite. If you're experiencing just the first stage, frost nip, rewarm the area in the warm water, and you should not experience prolonged effects with that. For preventing frostbite in any of the stages, you're looking at wearing appropriate clothing for the weather that's outside. You want to make sure that you wear lots of layers. You want to make sure that you stay warm and dry. And you want to make sure that you have some emergency kits with you, or emergency items, in case you do get stranded out in the cold for longer than you expect. Also, it's always good to make sure that a friend or a family member knows where you're going to be and when you're expected to return. So if you don't return on time, they can help to get you some medical attention quickly as well. So look for the signs or symptoms: red skin, coldness, followed by waxy, grayish type color in skin, very cold to the area. It'll go through stages of being uncomfortable, then the area may become numb. You need to seek medical attention if you're in that second or third stage.